You'll see in the chat function on your screen there's the call lines there. So please use the call-in lines in order to hear the audio portion of the meeting. Thank you so much for joining us today. My name is Leslie Craig. I am a public health advisor with the U.S. Department of Health and Human Services in the Office of the Assistant Secretary for Health in Region 5, and I serve as our Region 5 Adolescent Health Network Coordinator. I'd like to thank my partners and co-hosts, the Ohio chapter of the American Academy of Pediatrics, StartSchoolLater, and the Ohio Adolescent Health Partnership. Thanks to each of you in Region 5 and across the country for joining us in this regional discussion today. Today's session, Understanding the Role of School Start Times, is an opportunity to hear from internationally recognized authority on pediatric sleep, Dr. Judith Owens, along with National StartSchoolLater staff and those leading and working with local StartSchoolLater chapters in Region 5 in the states of Minnesota, Ohio, and Wisconsin. They'll be talking about their ongoing work to implement practices and policies focused on later school start times in an effort to improve teen sleep. Shortly, I'll introduce our discussion facilitator, Stacy Samara, who is going to lead our question and answer with first our expert panelists for about 20 to 30 minutes. Stacy will pose questions to them about their work, and then we'll open it up for folks on the phone, participants, to ask questions as well. So you'll be able to submit your questions either through the chat box throughout the session, and we'll also unmute call lines for folks that would like to verbally ask questions of our panelists. So today's discussion is being recorded, and an archive link will be sent out in the next days. So I just have a couple quick mentions to start off with. First off, open enrollment for healthcare coverage is open now. So 2017 coverage, you can go to healthcare.gov. It began on November 1st, and it's open until January 31st. However, if you'd like your coverage to start on January 1, or you know somebody that needs healthcare coverage, and the deadline to sign up is December 15th. So that's coming up quickly. So if you know folks that need healthcare coverage, please let them know to go to healthcare.gov and sign up before December 15th. What we have found in our work around open enrollment, particularly with young people and encouraging them to enroll, is that support from free personal help is available by phone and in the community. So if you go to healthcare.gov, you can find support. Not only you'll find the phone number to call, as well as a way to search for your zip code to look at plans and have somebody help you. And you can also let young people who are hesitant to enroll know that that they don't risk paying a penalty of at least $695 if you go uninsured next year. So if they check out their options at healthcare.gov, they'll find that plans may be more affordable than they think. So the deadline for January 1 is December 15th, and we're just making sure folks know that that particular deadline, as it's a very important one. Next, I'd just like to say briefly about the Region 5 Adolescent Health Network, one of the hosts of today's call and what I coordinate here out of our regional office. It's a forum to information share about the challenges and successes in programming, policy, and practices in adolescent health. And the regional network focuses on adolescent-specific work taking place across our 6-state region, which you saw the states in the previous slide. So you can sign up for our listserv, or you can contact me directly. You'll see my information is on the slides if you'd like to learn more. Next, I'd like to briefly highlight Adolescent Health Think, Act, Grow, or TAG, which is the Office of Adolescent Health's national call to action to improve adolescent health. It takes a comprehensive, strengths-based, positive youth development approach to adolescent health and highlights 5 essentials for healthy adolescents. So I encourage you to check out the TAG website, which is listed here, to learn more about Think, Act, Grow. And lastly, the Centers for Disease Control and Prevention has several places on their website on cdc.gov with information focused on sleep. Included here, you'll see a screenshot of a special feature page about school start times as an example of one of the many resources that they have about sleep. So I encourage you to visit cdc.gov for more information about sleep and adolescent sleep and school start times. I just have this quick disclaimer to put up before I introduce our speakers. and that is that any statements or views expressed in today's program are those of the presenters and do not reflect the views or official policies of the Office of the Assistant Secretary for Health or the U.S. Department of Health and Human Services. So I'll now introduce our facilitator for today's regional discussion, Ms. Stacy Samara. Stacy is an independently licensed social worker and certified substance abuse professional. She provides outpatient mental health therapy at a private practice in Northwich, Ohio, and conducts continuing education workshops across the state. Stacy also serves on the national staff of the nonprofit StartSchoolLater and serves as chair of the Sleep Committee for the Ohio Adolescent Health Partnership, the first state-level public health group in the nation to identify sleep as a core focus area. Stacy was named the 2014 Ohio Social Worker of the Year and was subsequently honored by the Ohio Senate. Following the facilitated discussion with our panel, we'll have time for question and answer, so please type any questions or comments you have in the chat box throughout the session, or be prepared to raise your hand to ask questions verbally. For any questions we're not able to get to today, we will collect written responses from our presenters and distribute that out to all the session registrants along with other resources following the session. So Stacy, take it away.
Great. Thank you so much for having me. And I'd like to remind everyone, if you're not talking, make sure you mute your phone so that we can't hear the background noise. And let me at least go over first some of our guest speakers. One of the first people that I will pose questions to is Dr. Judith Owens. And Dr. Owens is Director of Sleep Medicine at Boston Children's Hospital. She is faculty member of neurology at Harvard Medical School. She's an internationally recognized authority on pediatric sleep and the author of over 150 original research and review articles in scholarly journals, chapters, and books on the topic. Her particular interests are in neurobehavioral and health consequences of sleep problems in children, sleep health education, and cultural and psychosocial issues impacting sleep. She is also the lead author, some of you may know this, of the American Academy of Pediatrics policy statement issued in 2014 recommending middle and high school start after 8:30 a.m. She received her undergraduate and medical degrees from Brown, a master's in maternal and child health from the University of Minnesota, and she completed fellowships in behavioral pediatrics at Minneapolis Children's Medical Center and child psychiatry at Brown University. She serves on our advisory board at StartSchoolLater. We also have three people from StartSchoolLater that I'll be posing questions. Julie Dahl is a nurse practitioner who specializes in pulmonary and sleep medicine. Within her clinical practice, she manages the full array of both pulmonary and sleep disorders with a special interest in chronic obstructive pulmonary disease and insomnia. She has served on committees for the American Academy of Sleep Medicine and the Society for Behavioral Sleep Medicine. She's currently on the board of the Minnesota Sleep Society and is executive director of the Teen Sleep School Start Time Committee, which is a research-based policy building community initiative. She also serves on the board for the Minnesota Nurse Practitioners. We also have Kari Oakes today. She's a medical writer and physician assistant with a background in primary care and emergency medicine. She has extensive experience with adolescent and young adult populations, clinical and editorial experience in academic medicine, and writes regularly about the medical research and trends in healthcare. She's a mother of a high school student and a college student, and she's been active in education policy at the local levels for many years within adolescent sleep and healthy school start times. She's passionate about the need for evidence-based common sense interventions to protect health and safety. We also have Dolores Skoranek, and she lives in Greenfield, Wisconsin, and is an advocate for healthy and safe school start times. She has a bachelor's degree in biology, a master's degree in library and information science, and currently works as an academic reference librarian at Alverno College in Milwaukee. She's been a member of StartSchoolLater since 2011. She serves on the board of directors, and she maintains our Wiki, which I will mention later. So I'm very happy to have all of these people here.
Hi, this is Julie Dahl. Can you hear me?
Yes, we can hear you.
Oh, yeah, good. Thank goodness. So sorry. I had a hard time logging on. I'm not technologically inclined. I apologize for that.
Nope. You're good. So get ready. I'll be asking you questions here in a few minutes.
Okay, thanks.
As background, let me just throw a few slides up here as quick background, although I'm going to assume that most people on this call are familiar with some of the research. So I'm hoping that most of you guys know that adolescents should get about 8.5 to 9.5 hours of sleep. That's a range. There's going to be outliers. but not as much as what most people would think. The average adolescent, unfortunately, only gets about 6.75 hours of sleep on school nights. So the average adolescent enters the weekend 10 hours in sleep debt. The crux of the issue, and the next slide has a lot of text, so I apologize, but it's more running down, and Dr. Owens can probably describe some of this much better than me. But the big issue is there are very unique changes that occur during puberty. And this is what a lot of your general public and school administrators are not going to be aware of, because this isn't even in a lot of the medical textbooks yet. And that is that during puberty, adolescents experience both a later shift in when they secrete melatonin, and they also have this odd elongation of their sleep drive, both of which drive adolescents to stay up naturally later and want to sleep later. In fact, the sweet spot for sleep for adolescents is around 11 p.m. to 8, maybe 9 a.m. That's their sweet spot. So we know that waking an adolescent up too early not only reduces sleep, it also disrupts sleep, and that can be something that Dr. Owens, I'm going to pick her brain about that one. What we do know, and in the next slide you'll see that the Centers for Disease Control did issue a report in 2015 outlining that too many high schools still start too early. And the problem is a lot of people don't realize the math unless they do have teenagers that they're sending out in the morning. And the issue is that when schools start earlier than 7:30 in the morning, you have to connect the dots. And so what we know is that if school starts, for example, at 7:30, and you can see I showed a few clocks on the next slides. If school starts at 7:30, buses are typically picking kids up between 6:15 and 7 a.m. And what we know then from the next slide is if you wake a teenager up at 6, that is biochemically similar to 3 a.m. for an adult. Unfortunately, we have a lot of teens waking well before 6 a.m. And we know that chronic insufficient sleep
Hello?
Hello?
Stacey, are you there?
Hello?
Did the audio go out for everyone?
It went out for a while. Hello?
Stacey, are you with us?
Oh, Stacey just let us know that her connection was lost.
Hey, this is Stacey. I think you guys just lost me there for a minute.
We did.
Yeah.
Did.
Yeah, oh my goodness gracious. Well, if you look on the next slide, oh goodness, were you guys talking about me while I was gone? So as you'll see from the next slide, chronic insufficient sleep from a host of studies is correlated with everything you see on this screen. And in fact, I'd like to pose the first question to Dr. Owens, if she didn't get lost on the call too.
I'm here.
Awesome. In a few slides, we're actually going to pull up a screenshot of the American Academy of Pediatrics position statement. But before we get to there, can you talk a little bit about why sleep is such a health issue, not just an academic, but health issue?
Yeah, I think that this has really turned the conversation around, and framing this as both a physical and mental health threat to adolescents and also a safety threat, as you can see on this slide, when you talk about things like pedestrian accidents and car crashes and sports-related injuries in high school athletes. All of these things are not only incredibly important from a public health standpoint, but I think they really resonate with communities and stakeholders. And this has really moved beyond just an academic issue, although that academic performance, particularly on standardized tests and on core subjects, is critical to adolescent function and well-being. When we talk about all these health risks, and very serious health risks. I mean, when we're talking about accidental injuries and suicide, that is the first and third highest cause of mortality in the adolescent population in the United States. So number 1 and 3 in terms of causes of death are directly impacted upon by, and I like the term deficient sleep because as we'll see in a little bit, I think, it's not just how much sleep you get, it's when you sleep and whether that is aligned with your natural circadian biology. So I think this shift in kind of seeing this, and this has been echoed by the Centers for Disease Control and the AMA, as well as the AAP, to really frame this as a public health concern and as an epidemic, if you will, in our teenagers.
Thank you. And in fact, if we look at the next screen, these are just a few of the very many health organizations that have put recommendations. They've written position statements recommending later middle and high school start times. And I often point out to people, it's not like the Centers for Disease Control was sitting around saying, hey, we've cured every disease there is, let's look at something minor. Now, obviously, if the CDC is talking about adolescent sleep, it's an issue, as well as the American Medical Association and these and more. And in fact, so then on the next screen, you'll see this was actually many years in the making, the position statement here for the American Academy of Pediatrics. And I'd really love to hear from you, Dr. Owens, how this came about.
Well, it's probably about 15 years ago now. There was a group of us, a task force, that was comprised of pediatricians and adolescent health specialists and sleep experts that put together a technical paper for the American Academy of Pediatrics on sleep in adolescents. And at that time, we debated the possibility of developing a position statement on school start times that would accompany this technical report. And at that time, I think we ended up concluding that we weren't quite at the tipping point in terms of having enough evidence from schools that had successfully changed their start times and measured and reported on the results. Basically, we had the wonderful work that was done by Kyla Wallstrom and others in Minneapolis and Edina, Minnesota, and some work that Amy Wilson and Mary Carskadden did looking at impact of earlier versus later school start time, but we didn't have the kind of pre-post outcome measures that we would have liked. So when the time came to renew this technical report, and they have to be done on a periodic basis to kind of keep these up to date, this was a number of years later, and at that point, it's about 5 years after the original one, we really had reached the point where we felt that we had the scientific rationale to move forward. And so I won't bore you with the details of what's involved in applying to write a position statement for the AAP, but I can assure you it is an extremely rigorous procedure and way of moving forward. There are approvals at many different steps along the way. And in particular, the AAP remains very involved in editing, in making suggestions, in asking important questions about the policy statement as it evolves over time. And this was essentially a labor of love on my part, and I also want to give full credit to the other folks who participated in this process, including Mary Carskadden and Amy Wolfson and Dick Millman and Rhoda Au, all of whom were very important players in this. And this took over 4 years to create a policy statement that met with the approval from the AAP. And I am very, very grateful to their input and their willingness to, take this absolutely seriously and really come out with a product that I think has made a fairly substantial impact on the willingness of communities to think about doing this, because when the nation's leading advocate for children's health comes out in favor of something, I think it really carries a lot of clout. And so even though it was a long and sometimes arduous process to get there, I feel very pleased with the outcome, and I am also delighted with the support that this policy statement has continued to garner from the AAP, both the national office and state chapters.
Yes, and we thank you, Dr. Owens, for all of the work that you did on this. And suffice to say, and I'm probably underselling this, but if you're talking, for example, to a school board, the fact that the American Academy of Pediatrics published this position statement is significant. This was so well vetted. It was such a rigorous process, so many citations. It's not the same as a local newspaper editor writing an editorial. This is much more comprehensive and speaks a lot to the evidence. So
yeah,
actually we're going to ask you about...
I think that's true, and I think that virtually every article that covers this topic now cites that policy statement. So I absolutely agree that it has been quite influential.
Yes, thank you so much. And in fact, that was something that all of us involved with StartSchoolLater were thrilled to finally see published. And in fact, I'm going to ask Dolores a few questions. So Dolores is, and her bio is right here, and actually I am remiss that I didn't already thank Liz Dawson from the Ohio chapter of the American Academy of Pediatrics. The Ohio chapter of the American Academy of Pediatrics has been very generous in taking care of all the IT stuff. So you guys have people from 6 different states calling in, and Liz is sitting in an office in Columbus getting ready, and she is dealing with all the IT, and she's the one forwarding the slides on the PowerPoint. So we might say, click here or click there, and Liz is a trooper. She is keeping up with us. So in fact, while Dolores talks, Liz can feel free to scroll through the next few slides that tell a little bit about StartSchoolLater, but you could tell us a little bit about the role that the AAP position statement made, how it helps to frame it, how you got involved with StartSchoolLater, and a little bit about just this nonprofit.
Sure. Thanks, Stacy. I'm Dolores Skowronek. I just kind of want to reiterate what Dr. Owens and Stacy had already mentioned about the pediatrics policy statement. That had a huge impact as far as raising awareness of this issue on a national scale. And from my perspective, I saw the tone of people's attitudes towards later start times really begin to change once that policy statement came out. And I think one of the reasons why is because it was really covered very widely by the national media. I remember when that statement came out watching the Colbert Show at night, and he did a bit on that policy statement. So just little things like that really help spread the word and raise tremendous awareness about the start time issue. So I am with StartSchoolLater, which is a national nonprofit 501c3. We are an organization that is dedicated to raising awareness of the consequences of adolescent sleep loss and the impact of early school start times. StartSchoolLater began as a national organization back in the fall of 2011. And basically what happened at the very beginning was you had a group of moms in Maryland, and Kari Oaks, who's also on this call, happened to be one of those moms from the very early days. And there was this group of moms who had been advocating to change start times in their district, very intelligent, well-educated people trying to advocate for change who year after year were continually shut down by their school administrators. And what happened was, after having this happen year after year, these moms, they decided to get together and they formed the very beginnings of StartSchoolLater. And what happened subsequently after that is you had other parents like myself in Greenfield, Wisconsin. You had Dr. Catherine Darley in Seattle, Washington, pediatrician Lynn Keith in Florida, and then also Stacy Samira in Ohio, who were also advocating for change in their districts. And what happened was these kind of satellite moms joined this core group of StartSchoolLater parents, and that really was the beginning of StartSchoolLater as a true national organization. In the early days, we were all volunteer, which most of us still are today. We spent hours just kind of getting out the word, writing letters, blogging, making phone calls, doing TV interviews, phone interviews, radio interviews, trying to raise awareness of this issue. And in the early days, I mean, it was kind of hard because a lot of people didn't want to listen. But then you saw the pediatrics policy statement. There were other national policy statements that came out, the American Medical Association, American Sleep Association, National Association of School Nurses, the Society of Pediatric Nurses, and other local and regional organizations were putting out these statements. And as that happened, you saw the tide begin to change. Right now, StartSchoolLater is experiencing tremendous growth. Just this weekend, we added our 85th chapter from Burke County, Pennsylvania, and right now we're adding about a chapter a week. So to see this happen, to see the tide really start to change, I mean, it's very, very gratifying and very rewarding. As far as our goals, StartSchoolLater's ultimate goal is safe, healthy, equitable start times for all children. Short-term goals are to grow the organization and to continue to raise awareness of the issues of these early start times and adolescent sleep loss.
Great. Thank you so much, Dolores.
Yeah,
what
sure.
you'll see on the next page is if you go to StartSchoolLater's website and you look, we have a lot of options, but one of them is Get Resources, and this is available to anybody, even if you're not like a local chapter. And if you click on Get Resources, you'll see a lot of, for example, presentations. There's PowerPoints that are permitted to be shared. There's flyers. If we click on the next page, you'll see that there's brochures, color brochures that you could print, and trifold or even one-page sleep handouts. So there's a lot of wonderful resources created by a whole host of professionals. And then the next slide shows my favorite, and Dolores, is the creation of our Wiki, which is scholarly research articles, the kind that it's hard to find unless you're a college student and a professor's making you look for these articles. So Dolores keeps up on that. And in fact, one of the most recent research articles is one that it went viral last week, or actually I think it's 2 weeks ago now, and it was published by our own Dr. Owens, and the tag word seemed to be night owls. So Dr. Owens, I'm sorry, I'm getting my articles mixed up. In the next slide, you'll actually see a different article that Dr. Owens wrote talking about school start time change and in-depth examination. So the night owl actually is a couple slides from now. I'm out of order. But in this one, Dr. Owens, you highlight principles that schools can follow to successfully change start times for schools and for communities. Can you tell us a little bit more about this article's findings and what's important to keep in mind when you're working with local schools on this issue?
Sure. We wanted to publish something that was going to be of practical assistance to communities and stakeholders who are at various stages of contemplating making this change, because we we know that it's challenging for communities. And my team, when I was at Children's National Medical Center in Washington, D.C., worked with Fairfax County, Virginia, which is somewhere between the 11th and 13th largest school district in the country, with some 183,000 students and 27 high schools, to implement what they called their Blueprint for Change, which was the culmination of 15 years worth of effort to get the high school start time changed from 7:20 to eventually what it ended up as in 2015-16, 8 to 8:10. So we did a number of in-depth interviews with a variety of different communities and districts that had successfully changed their start times. We did a national survey study just to try to pull together some commonality of what really seems important in kind of going through this process. So the first thing that these folks told us was that leadership is absolutely key, and particularly that if the superintendent or his or her counterpart in terms of leadership, administrative leadership, is not on board with changing start times, then you're pretty much dead in the water starting out. And we saw that in Fairfax when they brought in a new superintendent, and all of a sudden the conversation completely changed to being much more of a positive one. By the same token, school board or school committee leadership is key. Involvement in the process, interest, representation of their various constituencies, bringing their concerns to the forefront, and hopefully eventually getting convinced that this is in the best interest of students. Similarly, leadership at the school level, principals, teacher support is vital, particularly if there's teachers' unions involved. And you also need to get buy-in from the leadership of not only the high school and the middle school, but also the elementary school as well, because in some of the scenarios that different communities have adopted, there is what's called a flip, where the high school start time actually gets moved later, and the elementary school bell times get moved earlier. So you need the involvement of parents and teachers at all school levels. It's critical to engage students. They can be your most vocal and passionate and convincing advocates for this. You have to really spend time educating the community, all the various stakeholders, and engaging them. I will tell you, in Fairfax, we held over 50, that's 50, individual one-on-one meetings with every group of stakeholder we could think of, ranging from the police department to the janitors union to community athletic groups to teachers unions, to make sure that all of the stakeholders felt that they had a role and they had an opportunity to voice any concerns that they might have. Transportation is oftentimes a very big issue for communities, and it's often where the price tag comes in for doing this. But in some communities, they actually realized cost savings because they went from a single-tier busing system to a 2- or 3-tier where they used the same buses to come back and pick up the next group of students. One of the things we really realized, particularly with Fairfax, is that it's critical to allow enough time for families to become informed about the change and to make plans ahead of time in their work schedules or their child care arrangements. For example, in Fairfax, the school committee voted in October of 2014 to change the start times, and that was enacted in the fall of 2015. So families had almost a year to kind of plan for this. While each community faces unique and different challenges, I think there are important lessons to be learned from other schools' experiences, and we're planning a national conference to help districts do that, which I'll hopefully have time to talk about towards the end. And I think really important is the anticipation of problems we heard over and over again was far worse than what actually transpired. That, school districts were concerned that teachers were going to quit en masse, that there were going to be horrible traffic problems, that there were going to be huge child care issues, after-school programs, and particularly athletic programs. That's always one of the big issues. But the reality is that communities adjust, and particularly when they're given enough time and there is the political will in the community to do this, it can absolutely be successful. And all of these perceived challenges either don't materialize or they're addressed by communities, the vast majority of which, I will add, in the United States have not gone back to original bell times. So this has been a roundly successful experiment on a very large scale.
And it's wonderful that this is a published piece now that is freely available for anyone to read, including the official blueprint Fairfax has widely shared. So thank you, Dr. Owens. Now, what I'd like to do is point out a couple different, we have quite a few chapters around here, and one of them is, and in fact, if you'll see up here, our slide is already out of date because this weekend we added our 85th chapter. But so we now have 85 chapters. We are truly launching nearly about one chapter every week new. But I'd like to introduce you to Julie Dahl, and she's involved with, like I said, the Minnesota Sleep Society, and she leads StartSchoolLater Minnesota. And Julie, if you could tell us a little bit about what's going on in Minnesota and any of the points that Dr. Owens brought up that you're facing at the local level.
Sure, absolutely. And I'll start with, again, apologizing for my naivete getting on here. But and I just started this process. So I'm on the Minnesota Sleep Society board, and we decided this year to do something beyond our typical annual conference and thought, what can we do as a sleep society in the community? Where is the main need? And, of course, this came out loud and clear as a public health crisis with our teens across the nation, of course, and in Minnesota. So I've only started this process here in February, so really pleased to be on this call with all of you who have had vast experience in this process. And I would say Judy was kind enough early in this process to share this article with me that she just talked about it, and it certainly has been true that the issues that she's outlined that their group came up with have definitely been the issues that we've been dealing with here in Minnesota. And I think, yes, the issues that do loom large do seem to work out in the end. The athletic piece that so many people talk about, they've really come up with impressive ways to deal with that here. Really they're talking about coaching smarter rather than coaching longer, so getting rid of some of these 2.5-hour practices. And it really helps that students are able to finish their homework. Another big issue people were concerned about is kids leaving early for school because of their athletic commitments, and they've been able to keep up with their homework. So I think that's been an issue that you're right, just didn't come out to be anything major at the end. And I think the other part, as far as the consensus building, and each community has gone, yes, everyone has their own sort of issues within each community, but it's really, there's some major issues that everyone deals with, but it's the first time, one superintendent described it for me, it's the first time for that community to go through that change. So it really helps to sit back and hear all the concerns that people have. And I think the other, education the entire community, I think, is the most difficult challenge, I would say, because if everyone knew about the importance of sleep, we wouldn't be having this meeting today, right? So I think the schools here in Minnesota have done a great job of engaging the community in seminars and video links. And the leadership is paramount. I think that's how we've been able to come so far here in Minnesota, is because of the superintendents here in the state. They've really served as our teachers. You know, most of the people in our group are coming from the clinical side, so we didn't really understand the full scope of what has to take place within each community for the school start time to change. So they've really been guiding us and educating us, and also have served as a leader not only within their own communities here, but they've been willing to share their experience with other colleagues. We found out early in this process and I've talked to others from Fairfax who really have been engaged in this process in their communities for years. So I was surprised within months of the Minnesota Sleep Society involvement to have superintendents talk about, because we've been talking with them at different board meetings and have had articles in their newsletters, and we talked about going to the superintendent conference this fall, and early on they said to us, you know what, Julie, we know the why now. We've heard the why, and I think the policy statements that have come out by the American Academy of Pediatrics and the other ones we've talked about have really started to be heard by the community. So what they said is, we want to know the how. What can we do within our districts? So we actually developed a panel of superintendents who spoke to their colleagues. So it was fabulous to have their leadership here within Minnesota. They've been amazing.
Well, thank you, Julie. You raise a couple different points. You do have to educate the community, and I think that also ties into a concern I have sometimes, is schools will often send out a survey asking parents, hey, do you think we should change school start times? And I point out, a survey does no good if you don't educate people ahead of that survey. And these days, I don't think a survey should be issued saying, do you think we should? But it should be, we need to change school start times. Give us your opinions of how. And in fact, Kari, I want to ask Kari a few questions, because Kari, you initially started out in Maryland, involved in Anne Arundel County, and then you moved to Wisconsin. So you have now been working, well, you worked more closely locally. I don't think you've had a chance to dive in locally yet in Wisconsin, but you have both local and national perspectives on this. So what input do you have for anybody listening here involved in the 6 states in this region?
Well, I think that everything everyone has said before, I would just echo. As I was listening, I was thinking about the particular things that I think have held true in different regions, and then things that might be different from place to place. I think that anyone who's beginning this effort in their local community just has to take the temperature of the willingness of their Board of Education and their administration in a particular school district to take this on. Find an ally from within if you can. And if you can't, you have more of an uphill road, but then certainly community education, which is always important, is even more important. I think that one resource that's available at StartSchoolLater is the advice of your peers. So, for example, in Pennsylvania, one of the recently added chapters over the weekend is adjacent to a couple of other chapters that have an active effort going. So sometimes a regional approach is really, really useful. By contrast, sometimes if you're in a small community, or say you're far north and you have short daylight hours in the winter, you can use the resources we have. We maintain Facebook pages, and there's one for chapter leaders, and you can just put a shout out to ask how people are addressing these issues all over the country. So you're not bound by region if you don't want to be. A couple of other things that stood out as I was listening is that, for example, in terms of the survey, you're absolutely right, a survey needs a context. Here in Madison, Wisconsin, I've been trying to build some capacity with people who want to get our middle school start times changed. I'm actually in a neighboring district where we have the very civilized high school start time at 8:25, and it's made a world of difference for my family. But there's a school board member who's working with a pretty amicable administration to get this changed, but they were all set to send out a survey, And I was able to refer him to all of the information from Fairfax County, thanks to Dr. Owens and Phyllis Payne, who's not on this call but who was instrumental in that change. And they were able to put the survey questions in context and to tweak them so that hopefully they'll get a better result because they used better instrument. So all of this resource sharing really makes a difference, but you still have to be flexible and understand your local community.
Great. Thank you so much, Kari. And I want to remind anyone that if you did have questions, don't forget on the lower left hand of your screen, you can unshrink a section that is Chat with Presenter. If anybody has any questions, you can type them in. And what I want to do is I'm actually going to ask Liz, we're going to skip one slide and see if at the end we have time for Dr. Owens to talk about it. But I want to point out, because we might have people from all 6 states of Region 5, and so we do have, in Region 5 is, of course, as we mentioned, Minnesota, and we had heard from Julie in Minnesota, which would be the next slide. And we might have people listening from Indiana, and I don't know if people know that in Indiana we do have a chapter in Monroe County, and so there's a way you can reach that chapter leader in Monroe County through the StartSchoolLater website. We have several different chapters in Illinois, which is one of the states served by Region 5. And in fact, we were hoping that the Chicago chapter leader could join us, but he's on shift in the emergency room now. He's an emergency room physician. And he emailed and said he wouldn't be able to get away because he has too many patients in the ER, which I know Mondays are actually a busy ER day from my days working in the ER. We also have a couple chapters in Michigan. For those of you guys that are in Michigan, if you're near these chapters, you can contact them for more information. And, of course, we have a few chapters in Ohio. We have Northeast Ohio, Hilliard. And, in fact, Hilliard, Ohio, the chapter leader there is a mother who is concerned about the fact that there are 6:04 a.m. bus pickups for middle school age. That's middle school age kids has 6:04 a.m. bus pickups down there in near central Ohio. One concern we have in Ohio, similar to other places, is the issue of local control. Like other states, we're very localized in how we run our school boards. So we have 614 school boards in Ohio. So it's very hard for one school to be willing to look at the change without coordination from their neighbors. But if you don't see any chapter here that is where you live, that you want to get involved, you can form a local chapter if you wish at StartSchoolLater. And that's something that is easy to at least ask questions. There's a lady, Debbie Moore. She is another volunteer. She's down in Texas. So you can ask her any questions. If you fill out this Contact Us form at the StartSchoolLater website, that is who you would end up reaching. Her name is Debbie Moore. She's got a wonderful Texas accent. But I want to remind people, if you have any questions, you have a wonderful panel of people here from some of the states that you guys might be calling from, and, of course, Dr. Owens. And, in fact, I do want to give Dr. Owens a minute here to talk about the national conference. I promised we would have time for that. So if you look on the next slide, we have an awesome opportunity coming up in 2017 to raise this issue again at the national level. So Dr. Owens, tell us about how the national conference ended up getting decided upon.
Well, about 6 or 7 months ago, I was contacted by a gentleman, Jim Healy, a businessman in Greenwich, Connecticut, who asked me if I was interested in his funding of a national school start time conference. And after I picked myself up off the floor, I said, sure, this sounds like a great idea. And subsequent to that, we have put together a great program committee, which consists of members of StartSchoolLater, Tara Ziborn-Snyder, Kyla Wallstrom, Phyllis Payne, heard mentioned from Fairfax, Wendy Troxel, and we are going to be holding this conference on April 27th and 28th. That's a Thursday and Friday. It's a day-and-a-half conference at the JW Marriott Hotel in Washington, D.C. And really the idea here is to bring together a group of hopefully somewhere around 300 school administrators, superintendents, school nurses, sleep researchers, other educators, policymakers, to really have the opportunity not only to hear an incredible cast of speakers, including people like Amy Wolfson and Mary Carskadden and Chuck Seisler from Harvard, and just an absolutely sterling lineup of experts in their respective areas. But there's also would be plenty of opportunity to network, to have a dialogue. We're planning on having an hour-and-a-half networking session on the first evening of the conference. There'll be workshops where people can come together in small groups and hear individuals who were involved in changing start times in their own communities kind of tell their stories and answer questions about practical and pragmatic issues that come up. So I think on every level, this is the first time anything like this has been put together. We're very, very excited about it. Our website will be up momentarily, but right now you can go through the StartSchoolLater website to get more information about registration and then to click on a link which will take you to the actual conference website. So we would love to see representatives from many, many communities around the country, small, large, urban, rural, suburban, come to this and really share ideas and experiences. And I think this will be an absolutely terrific opportunity to do that.
Yes, thank you, Dr. Owens. And like Dr. Owens said, this is ideally a conference that's about implementation. We want school officials to attend. So I'd encourage anyone listening that this would be a wonderful thing to tell your school officials about. Ideally they attend, but even if they do not attend, if you forward to them an invitation for them to even know that such a conference is being planned that has the backing of some of these sponsors you see right here, like the Robert Wood Johnson Foundation and the RAND Corporation, that sends a very clear message that this is a public health issue that is supported by experts. And so if you want to, you can contact StartSchoolLater and say, I want to be on the email list when the official invitations to the conference are submitted. But our timing is so unfortunate because I do think that website's going to be launched this week, but it just wasn't in time for today's webinar. But we'll keep everybody updated on the national conference. So if you don't already follow StartSchoolLater on Facebook or on Twitter, then make sure you do, and every local chapter has its own Facebook page. Usually you can find it just by typing StartSchoolLater and then whatever the local chapter is, Ohio or Hilliard, Ohio, or Wisconsin. And then Liz, feel free to chime in if anybody did have questions from the audience. And remember, you can type questions in, and then if any of the other panelists, if there was something that you didn't get a chance to say about what's going on in your state or what you would like people to do to get involved. But this, like Dr. Owens said, when you frame this as a public health issue, it becomes that much more clear of why everybody needs to be involved. I can't tell you how often I will have a school board member tell me, well, if it was such a big issue, parents would be talking. And I hear parents say, well, if it was such a big issue, my school board would be bringing it up. And everybody assumes that somebody else will talk about it. And in the meantime, our adolescents are going deeper and deeper in debt to sleep. And the consequences are dire. I mean, we're talking diabetes, car crashes, depression, are some of the things that can be correlated with, and I like Dr. Owen pointing out deficient, not just insufficient, but deficient, because it's also disrupted sleep. Sleeping at a time Mother Nature doesn't want you to sleep. So, Liz, did anybody type any questions, or I think we're just that thorough?
I do not see any in the chat box. I've been watching.
Great. I think that's a good sign. I think it means that everybody's been thorough.
And I would just like to say from Minnesota on a couple of those different things I didn't get a chance to talk about, sort of, which sort of feeds off of what you just said. You know, everyone's sitting there waiting for someone else to do something. And I think we in the medical field, you know, have said sort of, you know, why aren't schools doing this? But until you really get involved and understand more where they're coming from, you understand that we really need to go about this at a partnership. They need the information that we have from the medical side. We need the information that they have from the implementation side. So what we're doing here in Minnesota is developing a toolkit for those schools. So we're, summarizing that medical research that's, and making it more user-friendly for them to understand, and linking that to sleep. So many people think sleep is simply just for rest and recharging batteries, but to link that to depression and academic performance and risk-taking is so important. So like I said, we're developing this toolkit for them that they can use that have all those resources, like StartSchoolLater is obviously going to be linked to that resource, and we're advertising that toolkit here at the end of the month. So I hope we do get the sign up for the national conference, because we'll certainly link that. And this email will go out to every single superintendent and school board chair in the state of Minnesota. So if we can have that link, that will be really, really helpful for the national conference. And I think the other big piece I think that's really helped us here in Minnesota is we're connecting with other healthcare professionals. So we're asking a joint statement, and I realize there's been policy statements nationally, but we're really trying to make this personal, to talk about how many students in your state are affected. So in our state, it's 87% of our schools start before 8:30. So that's over 200,000 students, and that's just high school. That doesn't even count the middle schoolers who would also benefit from changing start times. So really, to make it personal, I think that really helps. So we're out there talking to them. And the Minnesota Medical Association, we are known as the birthplace, our cradle of Start School, and it's a lot.
Yes, you are.
Due to the Minnesota Medical Association, because they started early in the 1990s, exactly. So it was their statement that got the Edina folks talking and got Kyla Wallstrom on board, and she'll be the first one to admit that, when Edina called her and said, we should research this because the Minnesota Medical Association believes it would be important, she'll be the first one to say, nah, I didn't think it was going to do anything. And now 20 years later, she's still talking about it. So yeah, having them on board, so they've signed our joint statement that, we want to move forward. And so it's helpful to have, like I say, other medical professionals joining us in this effort within our state.
And is it not true that it was a psychiatrist in the Minnesota Medical Association that first raised the issue? I would like to point out, as a mental health professional myself, wasn't it the mental health professionals that said this is a problem? Yeah. It very well.
I knew it was a medical professional. I didn't know it was a psychiatrist. So you may be right. I'm new to this. That was 20 years ago for me. So yeah, it's very possible.
Yes, it was very possible. Well, if anybody has last questions, chime in. I really want to say this is.
But this whole conference call has been on. You need to have about 8.5 to 9.5 hours of sleep as an adolescent. I get like 8 hours. Well, you need to be having more than that.
Yeah, well, some people would even say that athletes need more. That a lot of people, now everybody differs on that, because I even asked Dean Beebe about that, do athletes need more? And he couldn't say that across the board, but we do know the range, depending on who you talk to. Some people say 8 to 10, some people say 8.5 to 9.5. But I can tell you what it is not 5 hours of sleep or 6 hours of sleep, like many Ohio teens have. And I've looked at the YRBS from every other state on this call. Nobody's getting enough sleep if you're a teenager in America on average. And again, it's not just duration. It's also sleeping during that sweet spot of sleep. So I'd really like to thank Leslie Craig. This was her idea to do a 3-part series. And we had parts 1 and 2 that were overviews of a lot of this science. And you can find recordings of those. Probably the easiest way is the Ohio Adolescent Health Partnership website. So that would be www.ohioadolescenthealth.org. StartSchoolLeaders.org in the newsworthy section. And everybody that participated on this call will get a follow-up email, I believe, from Leslie. She does wonderful follow-up emails with links to some of the things we mentioned. So Leslie, will you be doing that again this time?
Yes, absolutely.
Wonderful, wonderful. And I really want to thank the Liz at the Ohio chapter of the American Academy of Pediatrics for the wonderful web support and pulling it all together from an IT point of view. And all of the people on this call, especially those of us associated with StartSchoolLater, you have ways to contact us through the website. If from any of your respective states you would like to learn more about the resources or get involved, this is for countless generations of adolescent health. We can really make a big difference in improving the quality of lives of countless children and their families. So I want to thank everyone for their involvement. And if there are other questions that anybody didn't get to ask, again, pose them to us here at StartSchoolLater, and we will entertain any questions or concerns. So thank everybody for participating. Have a very safe Thanksgiving week.
Thank you.
Yes, and thank you so much, Stacy, for your facilitation of today's call. We will be in touch with that follow-up email, and please don't hesitate to follow up with me with any questions, and I can certainly connect you to our panelists as appropriate. So thank you, everyone, for your time and interest in this topic. Thanks to our panelists, all of our partners, and Stacy for your fabulous facilitation. Thanks, everyone.
You're welcome. Thank you.